Nowadays, the latest cause for agitation and vocal protests among medical students as well as doctors has been this internship delay. But what is this so called internship delay, and what exactly happens within this internship?
Well, you see, Sahas, with any degree, once you complete it, you need a successful internship period in order to go out and do further occupations. And this is very much the same for medicine. But the only difference between medicine and other degrees is that the medical internship happens after your degree. Now, when there's a substantial gap between completing your degree and getting your internship, that is called an internship delay.
So, that is, in your words, the definition of what we would call a delay in an internship. Now, generally, we do understand that this is a period in which you get professional experience and you get qualified to perform the work that is befitting your profession. But there is a consensus among the general populace. I'm pretty sure it's quite obvious that medical students already get a training throughout their degree. So people ask, why cannot a medical student immediately upon receiving their degree go into a practice?
Well, that's a very good question, Sahas, and it is something that needs to be answered. In theory and on paper, it does seem plausible because medical students, after all, do get a fair bit of clinical exposure. But in this clinical exposure, what essentially happens is that you're still learning. You are being groomed by a number of medical specialists and consultants to become a doctor. But after all this learning, when you get out to the field and when you have to do the hands-on stuff that needs to be done, the situation is very, very different. Every condition presents itself in a very different manner, and it is paramount that every doctor has a very good understanding about how to identify these conditions. The internship is what bridges the gap between a graduate and a doctor. This is a place where they get hands-on experience about managing patients and other managerial exposure that is required to work in a ward.
So, essentially, during an internship, you're training as a solo pilot, so to speak. You're getting your knowledge and you're, improving it and corroborating it in such a manner that you can operate on your own. And I believe this has everything to do with the general situation that the SLMC will only provide you with the proper registration to practice as a doctor within the country if you successfully complete your internship.
That is true, Sahas. With any country you go to, there is a governing body that determines the qualifications of a doctor to work in that country. And in Sri Lanka, that would be the Sri Lanka Medical Council. Now, in order to practice in Sri Lanka as a doctor, that is, to prescribe any medication or to approach a patient and treat them, you need the full and complete registration of the Sri Lanka Medical Council. And the SLMC will only grant you this registration upon the completion of a successful internship.
And just to clear any doubt, without the registration in the SLMC, you cannot operate not only in the government sector, but the private sector as well. You need your SLMC registration number in order to legally practice as a physician.
Very true, Sahas. Anywhere you want to work as a doctor in Sri Lanka, you need the full and complete registration of the Sri Lanka Medical Council.
So, with that, we have very well established that a proper internship is paramount in producing a good quality doctor and in order to practice legally as a doctor within the country. However, what is this delay that we speak of? We defined it earlier, but we would like to know why the delay is happening. Is there some institutional factor enacting upon this?
Well, definitely, Sahas. There is an institutional factor, and there's also the factor of the circumstances that we have to face. So I'll first take the circumstances that we have to face. These circumstances come in the form of the COVID pandemic that we had to go through in the past, and certain side-term issues that delayed the medical education of this country to a certain extent. Now, because of this, the granting of internships and, of course, completing the MBBS degree was delayed. But there's also a severe institutional factor that is tied to it. You see, the entirety of the medical education in Sri Lanka comes under the purview of the Ministry of Higher Education and the University Grants Commission. So the final MBBS exam, through which candidates are given a merit rank, is conducted by the University Grants Commission. This merit rank is then later on factored in by the Ministry of Health to give you your internship. But the internship is given to you by the Ministry of Health. So no matter how early the UGC conducts the final MBBS exam, the Ministry of Health will only give you your internship in November every year. So if a candidate was to complete their exams in, say, November, December, or January of a certain year, they'd have to wait all the way up until November of next year or that year to get their internship. That's a good wait of 9, 10, and sometimes even 11 months. And this wait is only expanding. The last batch to graduate had to wait over 1 year to get their internship, and this is speculated to lengthen to 1 year 3 months, 1 year 6 months, and so on. And this is the so-called internship delay that we are talking about.
So we have two organizations who are not talking to each other on any matter, but have their purview on the conduction of examinations in the form of the UGC, and then the Ministry of Health, who are supposed to hand over the internships. And stuck in between the vice clams of these two organizations are the medical students who are now graduates waiting to obtain their internship, basically wasting away their youth and the usefulness that they can obviously provide to the medical establishment of our country. Now, in addition to this, there is also a suggestion, a very popular one that has been leveled to quote-unquote solve this issue. That is to take in two batches simultaneously for internships. Is this plausible as a solution? Are there any particular drawbacks that stray us from it?
Yes, Sahas. Now, before jumping into that question, let me tell you a little bit about the available slots for internships in Sri Lanka. Now, the number of slots that are available are decided by something called a cadre revision. And this takes into account the number of medical graduates in the country as well as the needs of the country. But the last such revision was conducted in 2015, which was 10 years ago. And new medical faculties have been established. The needs of the country has changed, and so much more has happened within the course of these 10 years. So a new cadre revision is essential to determine the new number of internship slots that can be granted. But having said that, taking two batches simultaneously won't be a plausible explanation, because the internship is designed in a very standardized way to provide these graduates with the maximum amount of experience and exposure in working in a ward. Now, if we were to take two batches simultaneously, that would severely dilute the amount of hands-on experience and the amount of exposure that these graduates receive in wards. And that will lead to a subpar health system which we cannot afford. Because at the end of the day, the taxpayers of this country are paying for the education of these doctors with the hope of getting a good health system in the country. And if they are getting a subpar health system in the country, that means that they have paid for it, but they are getting a very subpar outcome. And that is very, very unfair.
So overall, with what you have said just now, we have a situation where an internship, which is paramount to producing a quality doctor, is being delayed through institutional delays that are being enacted due to a lack of communication, as well as a lack of coordination, and no real solutions being mounted for it. And the number of slots that are available for these internships, for these new prospecting interns, being determined by 11-year-old statistics, which are more than due for a revision. And finally, to add to it, the only real solution that's being actively suggested is one that will diminish the quality of medical education in Sri Lanka, which is being paid for by our taxpayers. And ultimately, all the diminishing returns that will come about should this continue will be borne not only by the medical students and doctors, but most importantly, and most tragically by the taxpayers of this country. And that, I believe, is why we need to put a stop to this and provide a sustainable solution.